This is a paid advertisement.
Welcome back to the Noon Show on WBAY TV2, and welcome to Ask the Expert. Dr. Lisa Campbell of Forefront Dermatology is with us today to talk about a topic that people should think about year-round, doctor, but as the weather turns, it becomes a little more forefront, and May is Melanoma Month.
It is. May is the month that we have chosen as dermatologists to bring awareness to skin cancer in general, and particularly melanoma, which is the most deadly form of skin cancer.
How is the prevalence of that now? I would imagine it seems to be getting more prevalent.
Probably more prevalent as our behaviors have changed, seeking sun behavior, and then also use of tanning beds. In the United States, there's about 76,000 cases of melanoma discovered every year, and about 1 in 5 Americans can have skin cancer in their lifetime.
So what should we look for as an individual when we are checking ourselves to make sure we don't become a statistic?
Yes, so we do encourage self-skin checks, and when you're doing a skin check, you're going to look for the A, B, C, D, E's of melanoma. The first of those is asymmetry, so the spot that you have should look the same side to side. The border of that spot should look very nice and smooth, maybe round to oval, but not jagged. The color should be even throughout the whole spot, meaning if it's brown, the whole thing should be brown, not brown with speckles of white and red. The diameter should be about pencil eraser size or less, and then also evolving means is your spot changing over time.
What are some of the risk factors that you can identify that would help people prevent this?
Okay, so the risk factors vary. In Northeast Wisconsin, probably skin color is the most largest risk factor in terms of if you have lighter skin, you are at higher risk of skin cancer. Also, ultraviolet risk. 97% of skin cancers come from ultraviolet exposure, so the sun is very important.
So the knowledge is one thing, and knowing the risk factors, but then the prevention, protecting oneself. What steps could we take?
Absolutely. The information that you'll find is basically sun avoidance in the middle of the day, utilizing sun protective clothing, as well as sunscreens. Probably an SPF of 30 is a good guideline for most people.
If individuals have checked themselves out, want to come see you, or even probably the best news they could get is that you send them home and say, you look great.
Absolutely.
How do they get a hold of you?
They get a hold of us, probably start at the website, forefrontdermatology.com or forefrontderm.com, and they can also go online for more information to things like the Skin Cancer Foundation or the American Academy of Dermatology.
That information is available to you on screen and always by going to WBAY.com and clicking on Ask the Expert. Dr. Campbell, thank you for being with us today.
Thanks for having me.
And we'll get you back into the Noon Show right after this.
The preceding was a paid advertisement.